Joining me right now is California Congressman Darrell Issa. And Congressman Issa, it is good to see you. Thanks so much for joining us.
Well, thanks for coming to our fine city of government. And, you know, I think we both enjoyed a good evening, better attendance than we expected.
It really was. It seemed well attended. But what was your assessment? What is your assessment of the contents of the speech? Was it a unifying speech? How did you see it?
I think this is too tough a time to call anything unifying, but the president did reach out. He did get the Democrats in totality, virtually totality, to rise more than a dozen times by expressing things that they had to say they were for, and they are for in many cases. I think it was telling that when he said end sequestration, only Duff, Rufusberger, and two others stood up on the Democratic side. Other than Mark Wayne Allen, Mark Wayne of Oklahoma, who was on their side. But except for one Republican standing in the Democratic side, that was sad, because sequestration, every member of the Armed Services Committee knows that it's really been an encumbrance to accurately providing the military what they need.
Yeah, we were just talking with General Jack Keenan. He made such a stunning statement. He said 50 to 75% of our aircraft cannot fly. We need to modernize. And I mean, 50 to 75% of our aircraft?
We have, in San Diego, we have F-18s that were supposed to be retired at 6,000 hours. They've flown over 9,000 hours. When they go in for depot maintenance, they typically are gone for a year, maybe two. Some will never come back. These aircraft are simply worn out. You know, it's one of the things the president has to deal with is, can we afford all the F-35s, or do we need to purchase, for example, the Super Hornet, the advanced F-18, which is less expensive, and we have in the fleet, but they're getting too old. Yeah,
which is why he did that shout out or call out to Lockheed Martin on the F-35. Let me ask you about the unifying question, because when watching the broad room, half of the room would not stand. I mean, the Democrats, did they stand at anything?
They did. They actually rose for about 12 times, but they were for the universal type items. I think one of the telling things is, even when he talked in terms of things they should be for.
And they didn't stand in that.
And they didn't stand. But, you know, that was sort of the plan, was they were going to try like crazy not to stand. You know, if he said, you know, motherhood and apple pie, it was like, do we really have to stand for this? And you'd see them come up slow. That is not the president's fault. That is the reality of where we are. It will pass. I was here. I was a freshman for George W. Bush when my Democratic friends would constantly say he was appointed, not elected. That sort of thing ended with 9/11. You know, the president last night talked about some things that not every Republican is keen on. He did send a shout out to the speaker, talking about these tax credits. Right. It was actually sort of surprising. You know, who would be against health care for anybody, and yet nobody stood for that on the Democratic side.
And that's what I want to talk about next, because he outlined some changes coming, or what he hopes to be coming, to Obamacare. Watch this.
Here are the principles that should guide Congress as we move to create a better health care system for all Americans. First, we should ensure that Americans with pre-existing conditions have access to coverage, and that we have a stable transition for Americans currently enrolled in the health care exchanges. Secondly, we should help Americans purchase their own coverage through the use of tax credits and expanded health savings accounts. But it must be the plan they want, not the plan forced on them by our government.
Yeah, that's the point. And the issue of affordability has been the major problem here, right? Do these changes that he's talking about address affordability?
You know, to address affordability, you're going to have to deal with the cost drivers of health care. He did mention the FDA approval process, which clearly is a cost driver. It slows down innovation. Time is money, $1 billion to get a new FDA approval. He didn't mention the liability it causes doctors and hospitals to do procedures simply to cover themselves. But I know he cares about it. Ultimately, he is a moderate on health care. He's made it clear he doesn't want to pull the rug out. He doesn't believe that we're going to eliminate all subsidies and credits, and he wants to see health care for all. So I would say that, you know, Democrats may be missing an opportunity to reach out to get if you will, Obamacare Plus.
Well, what about the debate within the House? I mean, when you look at Obamacare, are you going to be able to get something done on Obamacare in terms of the repeal and replace?
It's hard. It's hard because Obamacare, more than anything else, is a tax. So you repeal the tax, great, but you lose revenue. It is, after that, a large direct expansion of Medicaid. And in my own community and around the country, these community clinics have benefited huge amounts of money and new programs and eligibility. And so anytime you throw $1 trillion at expanding people getting their health care paid for free, you're going to do some good. We have to be careful not to undo some of that good. You know, I'll give you an example. Children coming in and having basic dental exams, the basic ability to do eye examinations to see if maybe somebody has early diabetes and so on. These are not things you want to get rid of. You want to keep some of the preventive things at our community clinics and so on. So the president's going to have to work closely, not just with repealing taxes, but with realizing that some of these expanded programs are going to remain popular. And they're going to remain popular with governors around the country.
Yeah, and we're seeing that popularity actually rise just recently.